Hello, everyone, and welcome to this week's Wellness Wednesday. Today's topic is going to be about how providers are keeping patients engaged in colorectal cancer screening and treatment amidst the COVID-19 pandemic. Our guest today is Dr. Howard, who will be taking us through this discussion. Dr. Howard, please introduce yourself.
Well, thank you. My name is Dominique Howard, and I'm a gastroenterologist at Capital Digestive Care in Washington, D.C. My clinical interests include colon cancer screening, a pertinent topic for today, healthcare disparities, gastroesophageal reflux disease, irritable bowel syndrome, and inflammatory bowel disease. And what interested me to go into gastroenterology is I saw a need for women, and in particular women of color, to go into gastroenterology, as this specialty was very male-dominated at that time.
Thank you for sharing all that with us. You have a lot to contribute to this, and we're really blessed to have you here. So tell me a little bit about how the clinical practices necessitated by COVID-19, such as more robust use of telehealth and increased personal protective equipment precautions, have impacted your office's ability to conduct colorectal cancer screening and/or treatment.
Great question. Well, Capital Digestive Care has the highest standards in place in order to ensure our patients have access to critical diagnostic and screening healthcare services. Pre-procedure COVID testing is required for all of our patients and our providers. And we have strict PPE and safety protocols in our offices and endoscopy centers. We utilize telehealth for patients who are reticent to come in or who may pose a risk to others. In addition, workflows have been changed to maintain social distancing. And with the above in place, we've been able to attend to our patients' needs. I want to also say that our staff has really risen to the challenge during this pandemic, and I want to commend them for being on the front lines, for assuring that our protocols are followed, and for keeping our patients safe. I really want to say to our staff that you are our truest heroes, and I am humbled every day by the work that you do. We have also been fortunate to have a partnership with AmSurg, who is a leading provider of colonoscopy in the United States. And AmSurg has helped us to access information and equipment during this COVID pandemic, which has also helped us to take care of our patients.
Well, that's great. I'm so glad that you've been able to get some additional support to help all the great work that you're doing out there. That's really reassuring to hear. And, we also understand that many patients have experienced challenges with getting used to some of that technology and additional support that you've been receiving, and that the communication style necessary to engage in telehealth is an extra skill set that people are getting used to. So what are some things that patients can do either during or before a virtual visit to help encourage a more productive appointment?
That's a great question. Being prepared for your visit is very important. It is helpful if patients can log in early to navigate any connectivity issues, and especially to be patient and flexible in case we need to switch from the computer to the phone or vice versa, which oftentimes could occur. Use the tools provided by the doctor's office, including pre-appointment instructions and patient portal accounts for communication. I think those are key to having a successful telehealth visit.
All right, that's wonderful. Yeah, this is the kind of information that our community really needs to know so they can make sure they're setting themselves up for success. So that's excellent. So you talked a little bit about your experience and your interest in health equity and health disparities. What actions has your office taken to help maintain relationships with patients that have been hardest hit by COVID-19? So elderly, underserved, and other communities like that.
Sure. Capital Digestive Care has always had an active local presence with outreach in the African American community in colon cancer screening awareness. This is very important to me as we have amongst the highest risks of colon cancer. Colon cancer being the third most common cancer and the third most frequent cause of cancer death in the United States, African Americans, and in particular African American males, have a higher risk of colon cancer. And African Americans are most likely to be underscreened and are 40% more likely to die from colon cancer. Most recently, I am one of the chairs and founders of the Capital Digestive Care Committee for Racial Justice. In this committee, I have helped to develop initiatives that will provide additional care and education to the underserved in our community. One of our goals is to provide education and mentor students to foster more African Americans in healthcare. And I am very excited about this program and hope to advance these initiatives within our community and our specialty. Capital Digestive Care also has a strong relationship with the Crohn's and Colitis Foundation. And you mentioned the elderly. We have taken extra steps to help our elderly patients if they need assistance with telehealth or have to come into the office to be seen.
All right. Well, we are honored that you are doing that work, and certainly thank you for doing what's necessary to make sure all populations that are being served by our healthcare system are being served fairly and justly. So thank you. And what can
Thank
our
you.
audience do to promote a greater sense of safety and comfort when preparing for a colonoscopy in this current climate?
These are definitely challenging times, and we will get through this together. At Capital Digestive Care, we are taking precautions, as I mentioned, including pre-testing our patients before procedures and regularly testing our staff for COVID-19. There are risks to postponing medical care, and I believe we have created an environment where people can receive the care that they need with complete confidence that their safety is our top priority.
Excellent. And November is Family History Month. Why is it important to talk with your family about medical family history when you're getting together this year, even if it's only over Zoom like this?
I always encourage my patients to discuss medical history with their family and encourage family members to get colon cancer screening. Genetics plays such a large role, especially in colon cancer and digestive diseases. Oftentimes, I have seen that family members may not be as forthcoming about sharing such information because they may be embarrassed about talking about a colonoscopy. This discussion can really save lives and also lead to better medical care. So this year, when you're with your family, either in person or via Zoom, don't be afraid to ask about medical history and discuss the importance of screening exams.
All right. Well, that is a message we can all take with us this year as we're getting into the holiday season. Dr. Howard, thank you so much for joining us today. It's really important that we get to bring on experts like you to help share this really valuable information. I hope all of you out there have enjoyed tuning in, and stay tuned for our next Wellness Wednesday where we'll give you some more wellness tips. Take care. Bye.